So if you've heard of cross-education effect and you're wondering what evidence exists for, to prove that it would be beneficial for your stroke survivor to use in their own homes, then this video will discuss some of the gold standard evidence that exists. Hi there, I'm Dr. Kenneth Monaghan. I'm a university lecturer, I'm a neuroplasticity expert, and I'm the author of Lights, Mirrors, Action, a guide for transforming the lives of caregivers and stroke survivors. I'm hugely passionate about trying to assist caregivers and stroke survivors to adapt their homes and make them the ideal place or an ideal place for them to carry out their stroke rehabilitation. So, I've mentioned before, there's a therapy that our research group, our Neuroplasticity Research Group, has been investigating over the last 12 years, and it's called the cross-education effect. And I've explained before, it's the idea that if a person uses just their affected side, or if a person strengthens one side of their body, then like going to the gym for 4 to 6 weeks and just strengthening one side of the body, the after the 4 to 6 weeks is over, that side of the body will naturally be stronger, but also amazingly, the other side can be up to 40 or 50% stronger, even though no active exercises have been carried out. And the reason for this is that there's a huge neural effect that happens from doing exercises on one part of the body. And we've mentioned before that this was first identified back in 1894 by Edward Wheeler Scripture. And since then, numerous studies have been carried out that show that this has potential. Now, I've mentioned that my advice to stroke survivors and caregivers is that we don't take the cross-education effect, the idea of just strengthening the non-affected side of the body all the time and ignore the affected side. That does not make any sense to me. But what makes sense is that for one period of the day, for maybe 20 minutes, that exercises are done with the non-affected side, strengthening exercises. They're done in a certain way, which we'll describe in a few minutes, and that they're done so that they excite the brain. They send more electricity to that damaged area of the brain, and it leaves the likelihood that neuroplasticity is going to occur much more likely. So, what is the evidence that exists out there? And I've mentioned before that the gold standard evidence that exists in medical literature is what's called systematic literature reviews. And our research group has become specialized at carrying out systematic literature reviews in different areas of the last few years. And we even developed our own training program for others that was available online through our university. Before we talk about those systematic literature reviews, another concept within clinical research is the idea of the minimum clinically important difference. And what this means is that for a therapy to prove itself to be useful to a patient, so we can prove that a therapy is better than perhaps a placebo or, an alternative treatment. But for it to be useful to a patient, we'd like it to be, pass a minimum clinically important difference level for that therapy. And with mirror therapy, the literature has shown that for mirror therapy for cross-education effect to make a huge difference, a noticeable difference in patients' lives, it should be at least 27% more beneficial than the other therapies, placebo therapies or other therapies that are used. So the good news for caregiver stroke survivors is that in the last few years, two very, very good systematic literature reviews have been published. The first, back in 2018, it showed that overall, when cross-education effect of strengthening was used in neurology patients in general, not just stroke patients, but neurology patients in general, that patients benefited by 29% of an increase in strength in the affected limbs. So this 29 is greater than the 27, so that would be a noticeable difference. So caregivers, definitely explain this to your stroke survivors, that this is something that can be useful. The second literature review, systematic review that was carried out back in 2023 from our own neurology, neuroplasticity research group showed that a 52% improvement in strengthening was found in upper limb cross-education effect with stroke patients. So this was very beneficial, a very nice paper to produce, and showed that overall the average was about 52%, which is very high. So the message coming through here is that cross-education effect is not the golden elixir of therapies. It's not the therapy that's going to make every person improve 100% after a stroke survivor. There is no such therapy, but it's been proven to be safe. It's been improved. It's been proven to be a very cost-effective treatment that can be used in your own home, and it's been proven that it can be carried out by all stroke patients sitting down or standing up. And the evidence suggests that it is well worth trying. My own opinion and experience is that cross education is just one of the many therapies that potentially excites your brain. It brings electricity to the dormant areas of your brain and stops that non use from occurring. So, when a person doesn't use their limbs after they've had a stroke, then the area that controls the use of that limb can be shown to atrophy, and it can reduce in size. So anything that stimulates the brain, stimulates those areas, will stop this non-use effect from occurring and is beneficial and gives patients a better chance of a recovery after their stroke. I hope you enjoyed the message today, and thank you for listening. If you would like some more information or resources that can back up this video, then please go to my website, which is www.lightsmirrorsaction.com, and there you'll find extra resources and information, extra YouTube videos, extra worksheets that might be useful to help you to carry out cross-education exercises in your own stroke survivor's home. Thank you very, very much for listening.